All right, tonight the COVID-19 public health emergency has ended. It expired today, meaning for the first time since January 2020, the virus is not considered a national emergency.
The ripple effects are being felt right here, with hospitals rolling back COVID-19 safety protocols. Though, as our Ethan Kibbe reports, experts are quick to warn the virus is far from gone.
A wave of relief at AHN St. Vincent Hospital.
I certainly couldn't do it alone and enjoy the team that I work with.
For the first time in more than 3 years, the hospital is dialing back its COVID-specific protocols, and Dr. Chris Clark couldn't be happier.
There's a sense of relief that I feel, that I know others feel, that we've made this this day, we've reached this day when the emergency declaration goes away.
3 years and millions of lives lost across the country. A steep price to pay for some hard-learned lessons.
As a country, I think there were lots of lessons learned, even with regards to that, is that we need to do a better job from a standpoint of identifying the disease so that we knew what we were up against.
But it wasn't all bad. A global crisis showed the world's capacity to confront problems and solve them in record time, developing, testing, and approving a vaccine in less than a year.
We started to turn the corner on this pandemic when that vaccine came out, and it really did help us have something in place to reduce the threat that the virus was giving us.
3 years later, life returns to a new sense of normalcy. The end of the emergency is not the end of the virus, but it is a chance to reset.
The virus isn't going away. It's here to stay. But we at least have now some sense of being able to make it our usual approach.
Ethan Kibbe, Erie News Now.
And the end of the emergency isn't all good news for everyone. It does carry insurance and vaccination implications that could lead to some people paying more for health care.